A doctor of chiropractic, often known as a DC, is a healthcare professional. Their primary focus is on diagnosing and treating neuromusculoskeletal conditions. This means they work with nerves, muscles, bones, and joints. They pay special attention to the spine and its relationship to overall health. Chiropractors use non-surgical, drug-free approaches to patient care. Many consider them primary healthcare providers, offering a hands-on path to wellness. Their goal is to restore proper function and help the body heal itself. They often work with patients experiencing back pain, neck pain, or headaches, among other ailments. Becoming a doctor of chiropractic requires a very rigorous educational journey. The curriculum is demanding and comprehensive. It is comparable in many ways to other doctoral-level healthcare programs. Students dedicate years to intensive classroom study. They also spend countless hours in laboratory settings. This foundational knowledge is crucial. It builds a deep understanding of the human body and its complexities. The scientific basis of chiropractic care is heavily emphasized throughout the program. This ensures graduates are well prepared to make informed clinical decisions. Beyond theoretical learning, hands-on clinical experience is a cornerstone of chiropractic education. This practical training is absolutely essential for developing the necessary skills. Students learn to apply their knowledge in real-world situations. They work directly with patients under the close supervision of experienced clinicians. This supervised patient care allows them to refine their diagnostic abilities. It also helps them perfect their adjustment techniques. This immersive experience transforms students into competent healthcare professionals ready for practice. The transition from student to practitioner is carefully guided. The entire structure of chiropractic education in the United States is highly regulated. The Council on Chiropractic Education, or CCE, plays a vital role. The CCE is recognized by the U.S. Department of Education as the official accrediting agency for chiropractic programs. This accreditation ensures that all programs meet stringent educational standards. It guarantees a high level of quality and integrity across institutions. Students can be confident that their education meets established benchmarks for the profession. This regulation upholds the credibility and trustworthiness of chiropractic care. The journey to becoming a doctor of chiropractic begins with an intensive study of the basic sciences. This phase typically involves approximately 1,200 contact hours of dedicated learning. These courses form the scientific bedrock upon which all clinical knowledge is built. Understanding the fundamental principles of human biology is essential. It allows future chiropractors to grasp how the body functions in health. It also helps them understand what goes wrong in states of disease. This foundational knowledge is critical for safe and effective patient care. It prepares students for the more advanced clinical subjects that follow. Key subjects within the basic sciences include anatomy and physiology. Anatomy involves the detailed study of the human body's structure. Students learn about bones, muscles, nerves, and organs. Many programs include gross anatomy laboratories where students work with human cadavers. This provides an unparalleled hands-on understanding of human architecture. Physiology complements anatomy by exploring how these structures function. It examines the complex interplay of bodily systems. A strong emphasis is often placed on neuroanatomy, given the chiropractic focus on the nervous system. Biochemistry and microbiology are also integral components of the basic science curriculum. Biochemistry delves into the chemical processes that occur within living organisms. Students learn about metabolism, cellular energy, and the molecular basis of life. This knowledge is vital for understanding nutrition and pathology. Microbiology focuses on the study of microorganisms. This includes bacteria, viruses, fungi, and parasites. Students learn about their roles in both health and disease. Understanding infectious processes is crucial for any healthcare provider, including chiropractors. The basic sciences also encompass pathology and public health. Pathology is the study of disease. It explores how diseases develop, the characteristic changes in the body, and their effects on function. This knowledge is essential for accurate diagnosis. Public health principles are also taught. These include epidemiology, disease prevention, and health promotion strategies. Chiropractors play a role in community wellness. They educate patients on healthy lifestyle choices. This broad scientific foundation ensures chiropractors are well-rounded health professionals. Following the intensive basic sciences, chiropractic students transition into the clinical sciences. This part of the curriculum is extensive, often totaling around 1,300 contact hours, which we will explore over 2 sections. Clinical sciences build directly upon the foundational knowledge already acquired. The focus shifts towards the practical application of science in patient diagnosis and management. Students learn to recognize patterns of illness and injury. They begin to understand how to assess a patient's overall health status. This phase is critical for developing sound clinical judgment and decision-making skills. Orthopedics and neurology are 2 major subjects covered early in the clinical sciences. Orthopedics involves the study and treatment of disorders affecting the musculoskeletal system. This includes conditions of the bones, joints, muscles, ligaments, and tendons. Students learn to diagnose common orthopedic problems. Neurology focuses on the nervous system, which is central to chiropractic theory and practice. Students study the brain, spinal cord, and peripheral nerves. They learn about neurological disorders and how they can manifest as pain or dysfunction. Understanding these systems is key to chiropractic assessment. Differential diagnosis is another crucial skill taught in this phase. This is the process of distinguishing between 2 or more conditions that share similar signs or symptoms. Chiropractors must be adept at differential diagnosis. It allows them to identify the most likely cause of a patient's problem. Importantly, it also helps them recognize conditions that may require referral to another healthcare specialist. This skill is paramount for ensuring patient safety. It ensures patients receive the most appropriate care for their specific health issue, whether from a chiropractor or another provider. General diagnosis and the art of the physical examination are also thoroughly covered. Students learn comprehensive patient evaluation techniques. This starts with mastering how to take a detailed patient history. They are taught to listen carefully to patient concerns. They also learn to perform thorough physical examinations. This includes assessing vital signs such as blood pressure and pulse. It involves systematic examination of various body regions. These fundamental clinical skills are practiced repeatedly to build proficiency. They form the basis of every patient encounter. Continuing the exploration of the clinical sciences, radiology plays a significant role in chiropractic education. This involves both the physics of X-ray technology and its practical application. Students first learn about the principles of X-ray generation and image formation. A strong emphasis is placed on radiation safety for both the patient and the practitioner. Proper patient positioning techniques are taught extensively. This ensures that radiographs are of diagnostic quality. Clear images are essential for accurate interpretation. Understanding the technical aspects of radiology is the first step towards using it effectively as a diagnostic tool. Once the technical aspects are mastered, students focus on radiological interpretation. This is a critical skill for chiropractors. They learn to meticulously analyze X-ray images, particularly of the spine and other joints. The goal is to identify spinal misalignments, also known as subluxations in chiropractic terminology. They also learn to detect other pathologies such as fractures, degenerative changes, or tumors. Correlating these imaging findings with the patient's symptoms and examination results is key. This integrated approach helps form a comprehensive diagnostic picture and guides treatment decisions. Nutrition is another important component of the clinical sciences curriculum. Chiropractors recognize the profound impact of diet on overall health and recovery. Students learn the principles of nutritional science. They study how different nutrients affect bodily functions and healing processes. They are trained in nutritional assessment techniques to identify deficiencies or imbalances. Based on this, they can provide patients with evidence-informed dietary counseling. This often involves recommending specific changes to support recovery. It also promotes long-term wellness and helps prevent future health problems. Finally, students learn about physical therapy modalities and rehabilitation principles. This equips them with additional tools to manage musculoskeletal conditions. They study the therapeutic use of various exercises. These exercises aim to improve strength, flexibility, and range of motion. Students are also trained in the application of physical modalities. These can include heat, cold, electrical muscle stimulation, and ultrasound. A key skill is designing individualized rehabilitation programs. These programs help patients restore function, reduce pain, and prevent re-injury, complementing chiropractic adjustments. In Section 5, the art and science of adjustment. Chiropractic principles and techniques. A significant portion of the chiropractic curriculum, around 1,000 contact hours, is dedicated to chiropractic principles and techniques. This is where students delve into the core of their future practice. The study begins with the history and philosophy of chiropractic. Students learn about the origins of the profession, tracing back to D.D. Palmer in 1895. They explore the core principles that underpin chiropractic care. These include concepts like innate intelligence, referring to the body's inherent ability to heal itself. This vitalistic approach emphasizes natural, holistic healing and the importance of a properly functioning nervous system. Spinal biomechanics and palpation are fundamental subjects within this domain. Spinal biomechanics is the study of how the spine moves and how forces affect it. Students learn about normal spinal motion and the consequences of abnormal mechanics. This understanding is crucial for identifying areas of dysfunction. Palpation is the art of using touch to examine the body. Chiropractors develop highly refined palpation skills. They learn to locate subtle changes in tissue texture, temperature, and joint movement. These skills are essential for identifying spinal subluxations or areas of joint restriction that may require adjustment. The diversified technique is one of the most commonly taught and widely used chiropractic adjustment methods. Students spend considerable time mastering this technique. Diversified adjustments are typically manual, hands-on procedures. They involve applying a specific, high-velocity, low-amplitude thrust to a spinal joint. The goal is to restore normal joint motion and function. This technique can be applied to various segments of the spine, from the neck to the lower back. Students learn the precise setups and lines of drive for each adjustment. Safety and patient comfort are paramount. Beyond diversified, chiropractic programs introduce students to a variety of other major techniques. This recognizes that different patients and conditions may respond better to different approaches. Students often learn about the Gonstead technique, which emphasizes specific X-ray analysis. The Thompson technique utilizes a special table with drop pieces. The activator methods technique employs a handheld instrument to deliver a gentle impulse. Upper cervical specific techniques focus on the top two vertebrae of the spine. Students may also learn various soft tissue techniques. This broad exposure allows future chiropractors to tailor their care. Section 6, from classroom to clinic, the clinical internship, foundational stages. The clinical internship is a pivotal part of chiropractic education, typically comprising 1,000 to 1,200 contact hours. This is where students transition from theoretical learning to practical application. The internship provides a supervised, real-world environment to hone clinical skills. Students begin to apply the vast amount of knowledge they have acquired. They work directly with patients, putting their diagnostic and treatment skills to the test. A strong emphasis is placed on professionalism, ethical conduct, and effective patient communication from the very beginning. This phase is crucial for building confidence and competence. The internship usually begins with Phase 1, which involves observation and preclinical training. During this initial stage, students often shadow senior interns and experienced faculty clinicians. They observe how patient encounters are managed from start to finish. They learn about the specific protocols and procedures of the teaching clinic. This includes understanding patient flow, record keeping, and safety measures. Students also begin to practice essential skills like taking detailed case histories. They review case files and participate in discussions about patient management strategies, preparing them for more active roles. Following the observational period, students progress to Phase 2, supervised participation. In this stage, interns take on a more active role in patient care, always under direct supervision. They may assist in performing patient examinations. They start to perform chiropractic adjustments with a faculty clinician guiding and overseeing every step. Documenting patient encounters accurately and thoroughly becomes a key responsibility. Interns learn to write comprehensive case notes. They begin to develop preliminary case management plans, which are then reviewed and refined with their supervisors. This hands-on involvement is critical for skill development. A major focus during these early internship phases is the development of clinical reasoning. Students learn to integrate their academic knowledge with the unique presentations of each patient. They practice formulating differential diagnoses based on history, examination, and any imaging findings. They must learn to justify their proposed treatment choices, explaining the rationale to their supervisors. Faculty clinicians provide constant feedback and guidance. This iterative process of assessment, action, and reflection helps interns develop the critical thinking skills necessary for effective and safe patient management. It bridges the gap between textbook knowledge and real-life complexity. Section 7, Mastering Patient Care, the Clinical Internship Advanced Responsibilities. As chiropractic interns gain experience and demonstrate proficiency, they advance to Phase 3 of their clinical training. This stage is characterized by increased responsibility and autonomy. Interns begin to manage their own caseload of patients. While faculty supervision and consultation are always available, students take more initiative in decision-making. They're expected to independently conduct patient examinations, formulate diagnoses, and develop treatment plans. This phase focuses on refining their adjusting techniques across a wider range of patient types and conditions. The goal is to build confidence in their ability to manage patients effectively. Comprehensive patient management becomes the core activity in these advanced stages. Interns are responsible for the entire continuum of care. This includes the initial assessment, the development of a full treatment plan, and ongoing monitoring of patient progress. They learn to adapt treatment strategies as needed based on patient response. If a patient's condition requires co-management with other healthcare providers, interns learn about interprofessional communication and referral processes. This holistic approach ensures that patients receive well-rounded care tailored to their individual needs and circumstances throughout their healing journey. Many chiropractic programs offer opportunities for community outreach and experience in specialty clinics. Interns may participate in public health events such as health fairs or spinal screening initiatives. This provides valuable experience in educating the public about chiropractic care and musculoskeletal health. Some programs have specialty clinics focusing on areas like pediatrics, sports chiropractic, or care for underserved populations. These rotations expose interns to diverse patient demographics and specialized treatment approaches. This broadens their clinical perspective and helps them identify potential areas of future specialization or interest. The final stages of the clinical internship also serve as a crucial preparation for the transition to independent practice. Interns continue to hone their patient education skills, learning how to effectively communicate complex health information in an understandable way. They gain experience in managing the practical aspects of practice, such as scheduling appointments and patient follow-ups. Understanding clinic flow and time management becomes increasingly important. Successfully navigating these responsibilities builds the confidence needed to step into the role of a primary contact healthcare provider upon graduation and licensure. Section 8, the professional landscape, business, law, and ethics in chiropractic. Beyond the intensive clinical and scientific training, chiropractic education also includes essential instruction in business, law, and ethics. This component, typically around 150 to 200 contact hours, prepares graduates for the non-clinical realities of professional practice. Students are introduced to the broader healthcare environment. They learn about their responsibilities not just as clinicians, but as healthcare providers operating within a complex system. Understanding these aspects is crucial for establishing and maintaining a successful and compliant chiropractic practice. This training ensures they are prepared for the multifaceted nature of modern healthcare. A significant focus is placed on healthcare law and ethics. Students learn about the legal obligations that govern chiropractic practice. This includes topics such as informed consent, ensuring patients understand their treatment options and agree to care. Patient rights and confidentiality, particularly under regulations like HIPAA, are thoroughly covered. Ethical decision-making is explored through case studies and discussions. This helps future chiropractors navigate challenging clinical scenarios with integrity and professionalism. Adherence to legal and ethical standards is paramount for protecting patients and the practitioner. Business and practice management principles are also taught. Many chiropractors choose to open their own clinics, so understanding the basics of business is vital. The curriculum often covers topics like creating a business plan and the fundamentals of financial management and accounting. Students may learn about effective and ethical marketing strategies to build a patient base. Aspects of staff management, including hiring and delegation, are also discussed. These skills are essential for the operational success and sustainability of a chiropractic office, allowing practitioners to focus on providing excellent patient care. Finally, proper record keeping and insurance billing are critical components of this training. Students learn the importance of maintaining accurate, detailed, and contemporaneous patient records. This documentation is essential for quality patient care, legal protection, and communication with other providers. They are taught the standards for proper documentation. Understanding insurance procedures, including how to correctly code and bill for services rendered, is also a key skill. Navigating the complexities of health insurance is a significant aspect of modern practice, and this training helps prepare graduates for these administrative tasks. Section 9, the final hurdles and future licensing and lifelong commitment. The journey to becoming a Doctor of Chiropractic culminates in a program that typically requires over 4,200 total instructional hours. Some programs may even exceed 5,000 hours. This rigorous and demanding educational path is designed to equip graduates with comprehensive knowledge and practical skills. The curriculum is structured to ensure that chiropractors are well prepared to serve as primary contact healthcare professionals. The intensity and scope of the education are comparable in hours to many medical school programs. This extensive training underscores the profession's commitment to high standards of patient care and safety. Upon completion of their academic and clinical training, graduates must pass a series of standardized national board examinations. These exams are administered by the National Board of Chiropractic Examiners, or NBCE. NBC Part 1 covers the basic sciences, including subjects like anatomy, physiology, pathology, and microbiology. NBCE Part 2 assesses knowledge in clinical sciences such as general diagnosis, neuromusculoskeletal diagnosis, diagnostic imaging, and principles of chiropractic. Successfully passing these examinations demonstrates a foundational level of competency in these critical areas of knowledge, essential for any practicing chiropractor. The examination process continues with NBCE Part 3 and Part 4. Part 3 focuses on clinical competency, evaluating case history, physical examination, neuromusculoskeletal examination, and diagnostic imaging interpretation through written clinical scenarios. Part 4 is a practical skills examination. It assesses the candidate's ability to perform clinical skills in real-time, simulated patient encounters. This includes diagnostic abilities, adjusting techniques, and case management skills. In addition to the NBCE exams, most states require chiropractors to pass a state-specific jurisprudence examination. This exam covers the laws and regulations governing chiropractic practice in that particular jurisdiction. The comprehensive training and rigorous licensing examinations ensure that doctors of chiropractic are well prepared to meet the diverse health needs of their patients. This entire process underscores the importance of competency and patient safety within the profession. However, the learning journey does not end with graduation and licensure. Chiropractors are committed to lifelong learning. They are required to complete ongoing continuing education courses to maintain their licenses and stay current with the latest research, techniques, and advancements in healthcare. This dedication ensures they continue to provide the highest quality of care throughout their careers.